Buen día, good morning, bom dia. Es un placer iniciar este seminario web sobre el lanzamiento
It is
para
a
las...
pleasure to begin this webinar launching the region of the Americas of the 2023 Progress Report of the Decade of Healthy Aging. My name is Patricia Morse. I'm Regional Advisor on Healthy Aging of PAHO WHO. I'm very grateful for everybody's participation today, and I hope that this session will be productive and a source of great information. Today's webinar is to celebrate the progress attained in the first 3 years of the decade in the region, share examples, and inspire actions that can expedite the implementation in the coming 3 years. So we invite you to become acquainted with the report and all the actions that are being deployed in order to attain the objectives of the decade. In the course of the webinar, we will share links that could be of interest to you on the chat. Before I begin, I'd like you to note that the seminar has simultaneous interpretation into Spanish, English, and Portuguese. You can select the language of your choice. If you go to the bottom of the screen and go to the globe, the event will be held in 2 panels. The first one with presentations and comments by countries in the region with the implementation of the 4 areas of action of the decade. And the second one is a conversation on moving forward in order to attain the objectives of the decade. With this, I conclude my introduction, and I'd like to invite Dr. Rhonda Silly-Thomas, Assistant Director of PAHO, to address the opening remarks. Please, Doctor, the floor is yours.
Thank you so much, and good morning, all. I warmly welcome all the distinguished guests, esteemed authorities, representatives of the UN agencies and the Inter-American System, members of civil society, and all the participants joining us today for this webinar to launch the 2023 Progress Report of the Decade of Healthy Aging in the region of the Americas. In particular, I would like to extend a heartfelt welcome to the representatives from the ministries of PAHO member states, Honorable Kirk Humphrey, Minister of People's Empowerment and Elder Affairs of Barbados, and Dr. Mario Solorenzo, Deputy Minister of Health of Costa Rica. As well as our other esteemed speakers, I also recognize Sir Roberto Rojas, Head of Section of Groups in Situations of Vulnerability, Department of Social Inclusion of the OAS, Dr. Pablo Ibran, Chief of the Health and Social Protection Division of the IDB, and Sir Simone Cecchini, Director of the Latin American and Caribbean Democratic Center of ECLAC. This activity represents the commitment of the Pan American Health Organization and the World Health Organization to monitor the results and acknowledge the progress achieved since the launch of the decade. It also highlights the significant engagement of the countries in the Americas in implementing the decade of healthy aging. The publication of this report allows us to review the achievements made to date and to plan accordingly for the next steps of the decade. In this sense, I would like to acknowledge the advancements made by the countries in the region towards healthy aging and to reflect on some of the challenges that we still have ahead. Firstly, I would like to congratulate the countries and organizations of the Americas who have firmly committed to addressing the well-being of older people. This is highlighted through the many case studies featured in the report and in the Decade's digital platform. In particular, I would like to emphasize the intersectoral and interagency work that has characterized the decade of healthy aging in the region, illustrated by the strong collaboration and coordination between UN agencies and the Inter-American System towards achieving the decade's objectives. Secondly, the report represents several regional initiatives, among them the Inter-American Convention on the Rights of Older Persons of the Organization of American States and the Let's Go Toolkit for Age-Friendly Cities and Communities, launched by PAHO together with Health Age International and AARP. These serve as examples to inspire similar strategies in different countries. Promoting innovative ideas and improving the use of existing resources provides a path for future action to enhance the well-being of our populations. Thirdly, I would like to reflect on one of the main barriers outlined in the report that may limit accelerated action in the next few years. The highlighted lack of financial resources signals the need for strong political commitment and specific budget allocations that support healthy aging. We must commit to increasing our efforts to consolidate health and social protection systems that promote healthy aging and favor economic sustainability. The demographic and epidemiological transitions the world is going through also bestow an unprecedented challenge for both health and social protection systems. This decade of healthy aging provides us with an opportunity to understand and to address this challenge. I wish to emphasize that despite the challenges that the world has faced since 2020, progress has been achieved in each of the 4 action areas, namely combating ageism, ensuring that communities foster the abilities of older people, delivering integrated and person-centered care that responds to older adults' needs, and providing access to long-term care for older people who need it. Please be reminded that the decade is an opportunity to catalyze efforts towards greater health, well-being, and equity as people age. Additionally, it will contribute to important social and economic benefits across the region through the active participation of older people in society. Therefore, we must guarantee the meaningful engagement of older people who must be central in shaping its implementation. Once again, I extend my gratitude to all of you for your participation and commitment to this important initiative. PAHO stands committed to support our member states to implement the decade of healthy aging. Dr. James Fitzgerald and his team from our Department of Health and Health Systems and Services represent that commitment, and I thank them for their leadership. Let us all continue to work together to achieve the decade's goals in the Americas and to improve the quality of life of older persons, their families, and communities. Thank you.
And now we will kick off the first panel with a presentation that has to do with the first decade and the challenge, which is to change our way of acting and thinking regarding ageism. And for that, I invite Roberto Rojas Davila, head of the section of groups in situation of vulnerability, the Social Inclusion Department of the Organization of American States, to begin the presentation on the Inter-American Convention for the Protection of the Rights of Older Persons. This is in connection with combating ageism. Thank you, Patricia, and through you, thank you to PAHO for this invitation to this important webinar. I will begin with a few things by way of background, but most of all, I'd like to highlight that the Inter-American Convention is a tool in order to combat ageism and to work towards the attainment of the goals of the decade. And what I'd like to highlight is why I'm hearing with an open microphone, so please. Well, the issue of a background before the convention, specifically since 1991, we start seeing the emergence of legal instruments such as the principles of the United Nations in favor of older persons, notions on aging. In 22, there's a political declaration in the Plan of Action, International Plan of Action of Madrid on aging. There's a regional strategy in 2003. And there's another second declaration. There's another plan of action specifically from PAHO in connection with the issue of the health of older persons, including active and healthy aging in 2009. This law and commitment all over Spain, and I will refer to this briefly, but also the protection of the rights of persons in 2012 in Latin America and the Caribbean. But none of them are legally binding. So this means that precisely in 2009, at the summit of heads of state in Trinidad and Tobago, a specific mandate was given in order to come up with a legally binding instrument in this declaration by the heads of state and government, where the mandate is given to the OAS with the support of PAHO in order to develop this legally binding instrument. So much so that in 2011, the General Assembly of the OAS issued instructions to begin the negotiations of this convention, and in 2015, the convention was adopted. With what purpose? Well, essentially to promote, to protect, and ensure the recognition and the full enjoyment of this right and conditions of equal rights of the enjoyment of these rights for the older person to contribute to their integration, inclusion, and participation in society. I would like to stress that this is the first convention in the world that protects the rights of older persons. And when I say convention, I'm talking about a legally binding instrument whereby the region as a whole has taken the first initiative so that in other regions in the universal system, they can also develop a legally binding instrument in order to protect the rights of older persons. And I had the opportunity to provide advice in the working group during the last stage of the negotiation. And the debates were very interesting and very interdisciplinary in nature. And they began with the very basic things that might seem basic to come to an agreement, but it was not that easy as a definition of what an older person is. So on the basis of international negotiation and the views of different countries, we came to a consensus that the definition of an older person older than 60 years, unless the domestic law says that it has to be older, provided that it doesn't go beyond 65. This is confusing, but the convention defines it as such, taking into account the fact that in many countries, they start using the retirement age as an age in order to recognize that this is an older person. So we also have a definition of what old age is. The convention defines this as a social construct and not as a biological issue, which is also very interesting, and a whole set of definitions. But what is even more important from this convention, no doubt, is a recognition of rights, which highlights the issue of having specific rights for older persons, where member states of the OAS have acknowledged that older persons have 27 specific rights. And within the 27 specific rights, obviously, we find elements that help us combat ageism, and they contribute in order to attain the goals of the decade on issues such as not only the acknowledgement and recognition of rights, but definitions such as discrimination because of age in the old age, and also how the definition itself of active, healthy aging, that is also very interesting, and it is enriching, and that supplements something that is contributed by the decade. But most of all, we see how this convention is connected with the issue of combating ageism, but also to comply with the objectives of the decade, and essentially how there is a connection with the fields of action. For example, in Action Field 1, how to change how we feel, how we think regarding old age or aging. It is Article 32 of the Convention, which highlights the need for promoting a positive attitude towards the old age, respectful, worthy treatment, considering the old age on the basis of a culture of peace, the promotion of rights, empowerment, and also to avoid this language and stereotyped images about the old age, which is very important. In Field 2, the issue of ensuring that the community should promote the abilities and skills of the older people. So the convention issues of the right to work, education, culture, leisure, sports, participation, community integration, the right to a healthy environment, and in Environment 3, to provide integrated care concentrated on the people in primary healthcare services, obviously the right to health, specifically in everything that has to do with develop, implement, and create public policies, plans, and strategies in order to promote active and healthy aging. And last but not least, the issue of Action 4, which is to facilitate access to older persons who need it. There's a specific article that deals with the right to receiving long-term care services, and that even led to some controversies. And to conclude, let's say that the decade provides us with the possibility of strengthening the work that is done by the region in order to bring together all the stakeholders amongst these. the levels of organizations of older persons in order to achieve the goal, which is improving the life of these persons and their families and the communities, as well as to acknowledge and protect the full enjoyment of the rights for older persons as stipulated in the convention and the decade. I'm sure that promoting a positive attitude towards the old age, older persons will continue to contribute to the building of fair and diverse communities in the Americas. Thank you very much. Thank you very much, Roberto. And next,
Hi, good morning, everyone. It's a pleasure to be here, to be a part of this webinar and this launch. It marks a very important step towards creating data and having databases, especially when we talk about small Caribbean countries like Belize. In Belize, we have a population of approximately 6% of older persons. However, by 2050, we're anticipating that that population will reach about 18%, which is almost 1 in 5. So when we talk about documents like the Inter-American Convention on the Rights of Older Persons, we are discussing at length the need to protect not only the present population of older people that we have, but that population of older persons that we are anticipating. In this area, we have been looking at how to strengthen policy, not only policy that directly impacts older persons, but policy that infers the need for the rights of older persons. For example, our recently revised gender policy in Belize has an area that speaks specifically towards our aging population and what the different roles within the gender dynamic and the gender discussions would mean. Also looking at changes within our approach to providing services for persons with disabilities and the work that the Council has been doing in conjunction with the Disabilities Desk. And the previous presenter highlighted 4 main areas. When we talk about the perception of aging, the Council has been working with a multi-sectorial approach addressing ageism and the perception of aging. With only 6% of the population being elderly, there are a lot of myths, a lot of negative connotations that's often associated with aging. And what we have found is that the need to connect with younger people and creating that bridge in being able to understanding that ageism not only affects the elderly, but also affects those older persons who are a part of our society. So where do we create those spaces for generations to connect? When we talk about promoting skills and rights, looking at older persons as entrepreneurs, Belize has a low rate of pension coverage. It's approximately less than 50% of our seniors have access to pensions. So many of our older people are working well into their retirement ages. So how are they able to access entrepreneurial skills? How are they able to access microfinancing? Where is this area for older persons and their right to be able to learn and earn as we become older? We also talk about the expansion of healthcare. Belize is presently expanding its national health insurance system, which is going to establish the second geriatric clinic in the country. And then we're also talking about working with providing long-term care, training not only families, but also training and certifying caregivers in the care of older persons. The Council recently launched its new strategic plan 2023-2030, which aligns itself with key developmental documents, both national and international. For Belize, it's a Horizon 2030 and Plan Belize. It also aligns itself with the SGDs and the Madrid International Plan of Action. And some of the definitions that we're looking to achieve in this area is an updating of the national policy for older persons, which was instituted in 2002 and hasn't been updated since its institution. But more importantly, using the principles and the rights outlined in the Convention on the Rights of Older Persons, Belize has moved towards drafting legislation for older people. We presently have a working draft that is under consultation to be submitted to government this year, looking for the first time at creating a space and legal protection for elderly. And there's also the development of our social protection floor, which for the very first time has highlighted the need to establish pension and pension coverage for the most vulnerable of our older people, which would be a state-funded pension in this instance. And these are some of the ways that we're looking at combating ageism. We're looking at creating a holistic environment so that we can not only address the needs of our older persons at present, but also looking towards what we need to have in place for those older persons that we are anticipating. Thank you.
Division of Aging, Seniors, and Dementia at the Public Health Agency of Canada to provide her 7-minute presentation. Franca will share your slides.
Great, thank you so much. So yes, if I will just say next, if that's okay. So thank you and congratulations to PAHO. Thank you for the kind invitation to share our work with you and for organizing this excellent webinar. I'm happy to be here with so many of you today to talk about Canada's work on age-friendly communities as one of the 4 action areas used to advance the decade. Through my team at the Public Health Agency of Canada, we've been leading the implementation and support to the age-friendly community model for over 15 years. We also provide federal leadership in advancing the objectives of the UN Decade for Healthy Aging. Next slide, please. So today I'll provide you with highlights of Canada's work to support the decade. More specifically, I will focus on our work in Canada to advance the age-friendly model, and I'll include some information about some of the challenges and opportunities we've encountered over the years. Next slide, please. To start, I want to share a bit of the Canadian context. Canada has a central national government that works collaboratively and in partnership with 13 subnational governments to help Canadians maintain and improve their health. Most of the health and social services delivered to Canadians happens at that subnational and community level. And like many areas of the world, the older adult population is the fastest growing demographic group in Canada, and they're projected to represent almost a quarter of our population within the next 2 decades. Across the federal government, there are a number of government departments and agencies that directly and indirectly support older adults and healthy aging in Canada. A few programs listed on this slide and many others support both the decade action areas as well as the 8 domains under the age-friendly model. Next slide, please. So just in terms of a bit of background, the government took an early and active role in supporting the decade. At the outset, we established an interdepartmental working group at the federal level, and this helped to ensure that all departments and agencies that had relevant mandates were engaged in building a collaborative approach to help advance the decade objectives. This group meets regularly to discuss work, to identify gaps, and to set joint objectives. This interdepartmental group has helped us in our work to monitor, report, and measure progress and the impact of our work over time. In November of 2023, we hosted a workshop in collaboration with the WHO to help identify data and measurement gaps. And we've collected public opinion research on older adults' views on healthy aging in order to help us better understand the factors that foster well-being in older age. As I mentioned at the outset, Canada's worked closely with the WHO from the beginning to help develop the age-friendly model. And since that time, we've established policies and have developed programs to develop and share information on age-friendly communities and to ensure its ongoing implementation across the country. Keys to Canada's success include the ongoing commitment to the work, including resource commitments, the grassroots approach to driving change at the community level, and the collaborative relationships we've built both at the international and national levels. Internationally, we contribute to AFC efforts by funding and working closely with the WHO to help advance AFCs, not only in Canada, but in other regions. And we actively participate in the global network as an affiliate member. At the national level, we provide funding, guidance, tools, and supports, and we support knowledge transfer. And we actively collaborate with other government departments and agencies whose work touch on those 8 AFC domains. Given Canada's governance structure, much of the AFC work is led by our subnational governments, as well as through our senior serving non-governmental organizations that work directly with communities, which is one of the reasons why we established a pan-Canadian age-friendly reference group, which I'll talk about more in a second. Finally, we have introduced a recognition framework in cooperation with subnational governments and the WHO to help recognize those communities who are on their way to becoming more age-friendly. Next slide, please. So I mentioned the Pan-Canadian Age-Friendly Reference Group, and this is really a key governance and information sharing mechanism for us here in Canada. It's been integral to maintaining a consistent, coordinated national effort to promote and sustain the AFC model in Canada. Regular monthly meetings enable members to share information, new resources, to discuss topics of interest, and to receive presentations from experts who present on relevant topics and answer questions. The reference group provides a mechanism to facilitate collaboration through partnerships, networking, and connecting stakeholders, through capacity building, through knowledge, research, and innovation. Each province and territory is represented on this Pan-Canadian group, and our membership includes those subnational governments, but also other stakeholders such as municipal level officials, older adults, academics, and non-governmental organizations. And we have various models across the country, and it's implemented differently in each of those subnational governments, but I don't have the time to get into that today. Next slide, please. I'll just touch on this briefly. I talked about in terms of advancing the approach, we came up in 2011 with Pan-Canadian milestones. And these are really the steps a community needs to follow to help ensure consistent, effective, and sustainable implementation. Over the years, we've found that communities that follow this milestones approach experience a greater success than those who do not. Next slide, please. Of course, there are some ongoing challenges and barriers to implementing the AFC model. And like the AFC domains, they're all interconnected. Evaluation, as we know, is an ongoing challenge, especially given that the needs at the community level are not static, then there's often a lack of capacity. Maintaining momentum and sustainability is often difficult as priorities change, as do the grassroots volunteers that help drive the projects forward. And it's important to identify groups of people whose needs have not yet been addressed and to meet the diversity and equity challenges. Next slide, please. Of course, there are key opportunities to keep in mind to achieve success. Those include including the lived experience and getting that commitment around the table, using our resources to guide evaluation and measurement of our work, strong local advisory committees that help facilitate sustained engagement, and finally, building and maintaining networks for sharing and publicizing findings and success stories can greatly help to steer the direction of AFCs. Next slide. Thank you so much. I'm a little over my time. I apologize, but thank you for the opportunity to share the Canadian experience.
Thank you so much, Franca. En seguimiento, invito a María del Carmen Vallardo Solórzano,
I
directora
now
general.
invite María del Carmen Gallardo Solórzano, who's the head of the Jalisco State Project in Mexico, who's going to speak about age-friendly communities. Thank you very much and good morning. I hope you're all well. I'm very pleased to be here with you to share some of our experiences in Jalisco. Jalisco is one of the major states in Mexico, and we've been pioneers when it comes to age-friendly cities. Since 2016, we made a commitment to create friendly environments for older adults. We've worked on our public policies with the purpose of recognizing, identifying, and harnessing all available resources to share experiences with other public institutions. We have also been raising awareness at the level of municipios and with all public officials regarding the needs of older adults and how environments have to be ready to support them as they lead active and healthy lives. So we've been working on this through the social assistance system for the 125 municipalities in the state of Jalisco. And we have focused on creating fora for the exchange of ideas, experiences, so that we can ensure that older adults, and especially those who are in a vulnerable condition, can find the services they need at our centers and can rely on sound decision-making to establish public policies that are appropriate and that we can share. We have developed materials, training, guidelines, and everything else needed to be able to monitor and follow up the activities that have been designed as for this sector of the population. It's been very important for us to consider everything that has been generated in our work with PAHO and WHO on friendly cities. They have provided us the guidance we needed so that we could apply the 8 strategic pillars that are part of building a friendly environment so that we can promote the tools. We have also done everything possible to ensure that older adults, especially those in vulnerable situations, can receive support in their decision-making. And on the subject of resources, this has always been important as we design activities, and we have also developed management tools with a view to ensuring that there's always resources allocated when decision-making takes place for tools and for evaluations so that we can have an exchange of ideas that will ensure that the pertinent actions are put in place to monitor programs and activities. We are also working with individual municipalities. This has been important because we have been able to take activities to a regional scale and generate environments so that older adults can have an exchange, so that they can engage in economic activities that are appropriate given their culture, and so that they can also participate in social and economic engagement.
¿Verdad? El poder ofrecer información.
Being able to offer information and advisory services to all municipalities has been instrumental. And we are very grateful for all the tools we have received from the Pan American Health Organization in this regard so that we could continue to build these environments. So far, we have been working at the local level in the state of Jalisco with its 125 municipalities, and we hope to take this to a more regional scale to all 32 states that are part of the Republic of Mexico, so that we can continue promoting age-friendly environments for older adults. Thank you. Thank you very much, Maria del Carmen. And now we move on to the next presentation, which is about the implementation of integrated care for older adults, ICOP, which is also another decade activity which seeks to partner with primary health care. I give the floor to the representative from Chile so that she can begin her presentation. Nanette, are you going to share your screen or do you want us to do it for you? And I'll be sharing from here. Thank you.
Hola, muy buen día.
Hello, good morning. What we would like to show you from the Primary Health Care Division is a presentation on the process to implement integrated care. We still have many challenges ahead, and this presentation was prepared by those working with healthy aging, both in the primary health care system and also with the Ministry of Social Development, which provides care for older adults. We heard a reference to the percentage of older persons. In our case, Chile is a country with an aging population. We can look at the percentage older people account for in the primary healthcare system. In our country, the first difficulty or challenge is that we have different cutoff dates for the health sector and for the social sector. In the healthcare sector, older persons, the category starts at the age of 60. 85% of these individuals do not require permanent assistance. They are self-sufficient. And we think it is important for these individuals to stay independent and remain functional. You can see some photos of what we do under primary health care. We provide integrated services aimed at promoting and integrating health without forgetting special adjustments that are required considering our country's geography and the lack of services in some areas. What you can see on the right is an elderly person in a northernmost community. We can see how they're using a technical area. They're working on their own, and this calls for us to reflect on the kind of design that is required so that we can have programs that are appropriate. In 2019, we began working with the Ministry of Health and Services for older persons. In our field work, we confirmed something we knew in theory, and it's like older persons often do not have information, they're disconnected from services, and they're also invisible, especially those that are dependent. We have a sport in Chile, which is ping pong. So we have different parties playing, but they don't communicate, and this makes our services inefficient. Looking at the healthcare processes, aiming for integrated services, we see that what we have, in fact, is isolated systems. They have different ways to evaluate. There are different pathways. We have different population groups. Some are being serviced, others have unmet needs, and we have vulnerable groups that are still invisible. Most of the care is provided in individual centers. They have their own programming and resources, but they are not specifically targeting older persons in their communities. Older persons have identified needs in different research studies. One of them is in the area of health perception. And there are differences based on gender, based on age, and also on education. When we look at older persons who have participated in the programs, and we've asked them what services they need, what they tell us is that what they need most is information about how to take care of themselves. Once they have completed these training sessions, they need to continue receiving ongoing information or communication. This helps them to take care of themselves. It's not just healthcare or medication. We have also seen the effect of social isolation and loneliness. This is also important, and we'll show you more about this shortly. Then we looked at what we were doing as part of our primary health care. We were providing care not in an integrated fashion, not comprehensively, but based on individual conditions. We asked them about satisfaction with the care received. Some cases we found that older persons were often not treated properly at the healthcare centers, and this is something that needs to be addressed. In 2020, we began working in the primary healthcare unit on the strategy, which is focused on the individual. The idea is to practice family and community health, understanding that we cannot provide the same care to all. They have different vulnerabilities, different needs, and it's important to include older persons in decisions made about their health care. Self-care is not just addressing symptoms. It's important to look at what happens with functional abilities and with other aspects of their life. We pose the following questions, and these are the questions I mentioned before. We don't have answers for them yet. We looked at how we should coordinate the different levels of care. Also, how can we exchange information with services specifically about older persons and about their evolution, and how can we design healthcare services that are not just comprehensive, but also provide specialized care. That's where ICOPE comes in. It is promoted by the World Health Organization. I'm sure you can find information about this. And it involves social processes and community-based processes to provide care for older persons. And this complements what we already have in Chile as far as evaluation of healthcare and social services. These are separate, they don't communicate. In 2020 or 2022, we looked at what happens when we implement the integrated strategy. It provides comprehensive care for older persons. We work to train teams to work with older persons, adapting the local arrangements. Promoted by WHO, we evaluated 118 older persons, and we asked them about their perceptions. And we did this with all participants, older persons, other participants, and institution staff. We are summarizing because of our time constraint. Elderly persons recommended simplifying evaluation, explaining results, providing training for self-care, more preventive care, and early evaluations. The institutional teams identified 4 things: improving the network capacity to discuss integrated care and include other dimensions such as health, sexual, and emotional support. We also need to look at the community capacity to provide this care. So we believe there is an opportunity to integrate social and healthcare interventions. We need to understand how the services communicate and how we can adapt strategies. To conclude, there's 2 programs that are critical and should be implemented in the case of primary health care. One is the program for independent older persons and also the national system. We are now in phase 3, or rather phase 2, and we are going to be working on all 3 areas: care, equity, and targeting, so that we can provide more timely care and involving older persons in evaluation and monitoring. That concludes my presentation on behalf of the Ministry of Health of Chile. Thank you, Nanette. I now give the floor to Isabel Barrientos, who will be offering us her comments based on her experience with ICOP in Costa Rica. Good morning, and thank you for inviting me to participate in this panel. Like Chile, Costa Rica has been characterized by a multidisciplinary approach to working with older persons at the primary level. We have screening for risk factors for the older populations, and this is done annually. it makes it possible for us to refer vulnerable individuals to more specialized assessments. But in conjunction with the areas of action of the Decade for Aging, we looked at the older person-centered approach from outside of the healthcare sector. This includes day care centers, which had not been considered before in other reports. The initial proposal was part of a chain of processes. We began with an interinstitutional coordination led by the Ministry of Health, the Costa Rican Social Security System, through the National Geriatric Hospital, the Pan American Health Organization, day centers, and other participating institutions participating in 2021. We did an assessment of the model and its implementation, first virtually because of the conditions in 2022. And in 2023, we began to offer training for daycare service staff in person. We worked with all the institutions to train staff. We went through the model identification phase, and then we assessed the results. We were able to identify strengths, barriers, and weaknesses. Among the strengths, I would mention the first, which are interinstitutional coordination, but also resilience across institutions to develop a national proposal during the pandemic. We were also able to assess the acceptability of the model outside of the healthcare system. And this highlights the importance of maintaining functional capacities in persons who are in direct contact with older persons. It made it possible to also ascertain how possible it is to measure the quality of services. There was also a raising of awareness, not only about the risk of evaluation, but also promoted the development of a plan based on individuals and also monitoring results. We are used to working with older models that are based on disease and which focus on identifying problems. Among the weaknesses identified with the ICOP model, we had to convince senior authorities about the importance of assessing the condition of older persons in the community that go to these day centers. In addition to the ICOP model, we learned that some of the tools need to be adapted for each country. The pathways for channeling patients to the first level is something which remains a challenge. We have not yet been able to guarantee a direct flow from the centers to the primary level of care. And the National Geriatric Hospital took the lead for addressing this challenge. There's also another need, which is generating capacity in the country when it comes to the ICOP model to pave the way to have a healthy aging population that is functional. Finally, we need to raise awareness about the importance of preventing dependence by recognizing individuals' intrinsic capacity, and ICOP is a model that makes that possible. Thank you very much. Thank you very much, Isabel. We will now hear from on how to provide long-term care for older persons requiring it. And to do that, I invite Maria Carolina Pereira Aures, who's the director of the primary care, early childhood and senior care for the Ministry of Social Development of Brazil. Carolina, I would like to offer you the floor at this time. Would you like to share your screen for the presentation?
I will share my presentation. Good morning.
Good morning.
Thank you. I would like to thank you for
and
the invitation, offering the opportunity for us to share the Brazilian experience, as well as exchanging with other participants. Can you see my screen now? Yes, but it's not, you see the notes, it's not a presentation mode. You need to set it up as a presentation. Can you do the sharing then, Brenda? It's working now. So again, thank you for the invitation. And I am going to be talking about the construction of the national caregiving policy in Brazil. Last year, we created the National Secretariat for Family Care and the National Secretariat for Economic Autonomy and Caregiving for Women. And to start this work, working groups were established in March 2023 to deliver in May 2024 a diagnosis of the needs and the what is being offered in terms of services in Brazil. We have 20 ministries in the different areas, especially the larger social systems in Brazil, the SUS, which is the socialist system, the health system in Brazil, and also 20 other ministries and people who were invited from the National Institute of Statistics and Geography, the Institute of Applied Research, and Fiocruz, which is a research organization as well. So the starting point, each of these public policies has different concepts. So we need a common base. We have to understand caregiving as work that is being done daily, producing goods and services necessary to the reproduction and maintenance of life and to ensure the well-being of people. There are daily tasks like cooking, cleaning, organizing, managing houses, support to daily activities with people with different levels of dependency. Also, this caregiving is a need and a right for everybody. It's a universal right. We will all need care and we probably will all give care, but during the life cycle, the needs will be larger, especially when people become more dependent. We have to think about caregiving as an essential public good that will allow for the reproduction of the workforce and for society and economy to work. So for this national caregiving policy in Brazil, we are simultaneously looking at those who receive care, need care, and also those that give care. If we look at the social organization of caregiving in Brazil, we have to recognize that we are, it's not equitable. And among families, women are the ones that have the highest load, double than the work that men need to do. And even worse, when we talk about lower income people and Black women. Black women work a week more than white women a year. This workload it leads to time poverty. It's a obstacle for people to exercise their rights and to participate in public life. In Brazil, 30% of women that are not working at working age, the reason why they're not working is because they have to give care. And when we talk about Black women, that percentage is 32%. And those that have children, especially small children, then that percentage is 61.8%. And if we look at a remunerated caregiving, that is to say, a labor market for caregivers, 45% of the workforce are Black women. So the work is not only based on women, but it's also racialized. And there are needs that will be increasing as the population ages, as we see in many countries, and also a reduction in caregiving by the families. Families are nuclear families, they have fewer and fewer children, and in the long run, they cannot offer this care. In the census in 2023, we saw 20 million people that were elderly now have increased to 21%, and it will be 30% of the population in 30 years. The percentage of elderly people older than 80, it will be tripled. It will be 7% of the population. If we look at the elderly, 1/4 have some type of problem. When they reach 80 years of age, more than half have some sort of a problem. So this will generate dependency and the need for care. Women will be overrepresented among elderly. Women live longer in Brazil, 7 years longer than men. And when we look at those that are over 80, women are double the number of men over 80. If we think about income, high dependency on families to care for the elderly, 20% of the houses. The elderly are responsible for half of the family income, and 18% only have the income of the elderly person. So it's important to look at the social benefit that the state offers to the elderly and those that cannot maintain themselves. And lastly, this is a group that needs care, as we saw, but they also offer care, especially when we look at women. The average in women that do this non-remunerated work is 21.5 hours between 60 and 69 years of age. People who would be retiring 24 hours. So we have then an age bracket that requires care, but is also giving care to their partner, to children, to grandchildren, so that people in the family can work. This shows that we need to transform the social organization of caregiving, and the state has a fundamental role. The public support is not enough, and the responsibility of care cannot be based disproportionately on families and within the family on the shoulders of women. So to conclude, we have some objectives in this national policy: ensure that everybody that needs care will get it, so that we have progressive universalism, ensure work for those, and decent work for those that are working in caregiving, make visible this caregiving work, giving more time to women, promote a culture of co-responsibility among men and women, also within the family, community, state, the market, the corporations, and also recognize the structural the inequality in our society, inequality based on gender, race, and others. And some of the things that are priority and that will be need greater support are children, teenagers, people that have problems, elderly people that need caregiving to be able to cope with their daily life. And here are some examples when we talk about caregiving policy. When we have elderly people, they should have waivers in their work so that they can take care of those that they care for. Also, we need monetary benefits, cash transfers, day centers for elderly people or people with discapacities, also centers to receive the elderly. We need to have better quality parameters in these care centers, and the cultural transformation so that changes are possible, and changes in culture. This is the link for you to access our information. The last report was on aging and the right to care. Thank you very much.
Director de la
And now I
CELADE.
invite Simon Secani, the director of CELADE in ECLAC, to offer his comments in connection with long-term care. Simone. Thank you very much, Patricia. Thank you, Maria Carolina, for the presentation. Care is an essential issue in the decade of healthy aging, and particularly in the region, the policy area, where we have to move forward to make more progress. Care is provided inside the home. There's gender inequality. Women provide the care, and we need to promote the shared responsibility and for the state to participate in order to propose policies and integrated care systems. Thus, I'd like to stress and highlight the process that has been carried out in Brazil in order to develop the national care policy. It is innovative, participatory, and it has also had the support of ECLAC and different United Nations agencies. And care is a core issue for life, for development. The pandemic showed that with full force, because the provision of care for the sick person, the children, was essential for societies to work during the pandemic. And therefore, from ECLAC, we call upon everybody to launch a care society. All human beings need care at some point in our life, and especially older persons, people with disabilities, with chronic terminal diseases. They do need these long-term care services or palliative services. But to build care policy systems face different obstacles in the region. One is the issue of economic resources. Two, the more family-centered approach of a social construct of the care, which maintains that view for women to take over. Three, the lack in a gender perspective. And four, even the lack of data showing and proving what the population is needing, the care, the culture that exists, what is necessary, the people that provide care services professionally. So in that sense, from the presentation made by Brazil, it seems to me that the perspective of rights is concentrated on the family-centered perspective. We saw a lot of data, so the issue would be whether they achieve the political and economic support in order to implement everything with the adequate resources in the system. So from ECLAC, different subsidiary bodies have spoken and placed the accent on care. The Regional Women's Conference, Social Development, Population and Development, with the consensus, the Montevideo Consensus. In 2022, within the framework of the Intergovernmental Conference on Aging and the Rights of Older Persons, they adopted the Santiago Declaration in order to move towards an inclusive care and resilient care society. And also from CELADE, we see the population trend in the region, and would like to highlight the demand for care, as we saw in the case of Brazil, how it increases because of the aging of the population. Older persons have a greater risk of showing some functional dependency. So think that in 2024, the region has 95 million people over the age of 60. And at the end of the decade of healthy aging in 2030, we will have 20 million more, 115 million older persons. And within that age group, the group that strongs the most is 80 years and over. And obviously stressing the presentation by Brazil, highlighting the importance of the many inequalities, and therefore the need for moving forward towards a provision of care concentrated on equality and non-discrimination. Thank you. Thank you very much, Simona, and thank you to each and every one of you for your participation and your statements. And next, I'd like to invite Dr. James Fitzgerald, Director of the Health Systems and Services of PAHO, to moderate over the next panel.
Webinar, and I really want to acknowledge the excellent interventions and presentations from all the countries, all the member states of PAHO, really highlighting the advancements, and I think some of the challenges that we are addressing as we move forward with the decade of healthy aging. We've organized a panel for you now in this final part of the webinar. And we're really happy to have with us the participation of Dr. Flor Murillo, who is a representative from the Ministry of Health of Costa Rica and the focal point for aging within the Ministry of Health of Costa Rica. Also Dr. Lina Walker, who serves as the Vice President of Health Security at the AARP's Public Policy Institute. And our colleague Pablo Ibarran, who's the Chief of the Division of Health and Social Protection at the Inter-American Development Bank. So to our participants in this panel, I really want to welcome you. I see that you're all present. And with that, I think we can move straight into the panel discussion, really taking on board some of the issues that we've heard highlighted in the presentations, highlighted in the opening remarks also from our Assistant Director, Dr. Rhonda Seeley-Thomas. So I'm going to open the panel with a general question for you all. And it's around one of the specific challenges I think that we've seen with the report on the decade. We note that significant advances have been made during the first years of the decade. However, we also heard from our Assistant Director the issue of resource allocation, resource assignment, resource mobilization, and not just financial resources, but also human resources that are required to address the enormous challenge that we face. So I think the question I wanted to pose to you is, so why do you think we find ourselves in this position, knowing that we've known for some time that the demographic and epidemiological transition is occurring quicker in the region of the Americas than in many other regions. So why have we found ourselves in this situation? And then from your perspective, what can we do almost at either the national or regional level to address this challenge within the Americas and to support countries in really the effective implementation responding to this challenge? So with that said, I'll ask that question. What we'll do is maybe we'll have a first round of comments, maybe 2 to 3 to 4 minutes from each participant addressing that, and then we can move into follow-up questions on that. So Flor, can you speak to some of those issues that I think we've heard from the presentation, but really honing in on the issue around resource allocation and mobilization that we need to address if we're going to be really meeting the targets that we've set for ourselves in the decade. Over to you, Flor.
Muy buenos días, muchas gracias por la oportunidad.
Thank you. Good morning. Thank you for this opportunity. We face a lot of challenges ahead of us. Even though we try to do things, we have to think about access, we have to think about resources, we have to think about the fact that this is a worker for all older persons, not only for just a few. And this is one of the greatest challenges. How do we reach people? How do we do that? Well, first of all, we need an issue of political will. The hierarchies of the government, not only of the central government, but the local government, They must be sensitive and paying attention to the needs of older persons. Why do I bring up the local government? Because it is in the communities where things happen and where processes take place. And it is on the basis of that where we have to provide support and do our work. So my message today is essentially that the work to be done with the communities is essential for people to have local opportunities. But this is not an easy challenge. We must raise awareness, we must conquer, fall in love with everything that has to do with the aging and everything that has to do with what this entails or what this brings with it, and the capacity of the intrinsic society in order to have more inclusive and more diverse societies to be able to age. So one of the challenges is this when I work with the communities to work, and the other one is how to combat the ageism. Ageism has to be combated from the early childhood. We need to teach children the way we teach them how to recycle. We have to teach them everything that has to do with this in order to have a future where we have societies that are free of ageism so that people can have more opportunities in their daily life. Another one of the challenges is the economic issue, the political issue, which has to do with the resources, the allocation of resources. If we do not have a political support, we do not have allocation of resources. But resources can be found also in the private sector, not only in the state. And for that, we need articulated work, management, and interaction with all the social sectors involved. To me, these are the challenges that we have to face currently. Thank you.
So much, Flores. So, Linda, we've heard from Costa Rica the importance of political commitment and the corresponding allocation of resources, either from the public-private sector and the mobilization of the community with regard. From the perspective of the AARP, how do you see this also within the broader challenges of really mobilizing those resources that we need?
Great, thank you for that question, and good morning to everybody, and thank you for the opportunity to be part of this wonderful panel and this discussion today. Let me introduce the AARP just a little bit. AARP is the largest nonprofit, nonpartisan social mission organization in the United States. We are dedicated to empowering people 50 and older to choose how they live as they age. And we advocate for what matters most to the over 100 million 50-plus Americans and their families. And we work in the areas of health security, financial security, and personal fulfillment. And AARP has been active and continues to be active and engaged in all the 4-decade action areas, partnering with stakeholders from across different sectors. And going specifically to your question, I think part of the challenge is sort of a good and a bad. I think that there have been a lot of progress and advances made in advancing the 4 action areas. And because that's moving quickly, perhaps the funding hasn't kept up with the progress that's made in those areas. So I think, for instance, of the work that AARP is engaged with around the Network for Age-Friendly States and Communities. So today we have 818 members, including 10 states and a territory, and it covers over 100 million people who live in towns, cities, communities, counties, and states. And that speaks to how quickly we've made progress in this area. And so the funding just hasn't kept up with all the progress that we've made in that area. So to Flora's point, a lot of what we can do is by partnering with civil societies, private sector, for instance. And what AARP has played a role in this space is to offer technical assistance, expertise, guidance, toolkits, so that we can help communities as they're standing up their networks and support them in those non-financial ways. But we also offer grants, small challenge grants, to help communities stand up, jumpstart, and pilot some of those activities. So in that way, It's true that there might be constraints, but I'm more optimistic than I am pessimistic in the sense that I feel that it's just simply a little bit of catch-up happening. I do think that part of the barriers, though, also reflects changes in sort of the external environment. And so I say that with respect to family caregiving, for instance. We know that population is aging in the US. 1 in 6 adults are already 65 and older, and we're going to see like more aging into the age group that will require long-term care. And the way our healthcare system is organized, that a lot of family caregivers now are taking on very medical tasks. So in addition to providing personal care and everyday support, they're also having to do wound care. They have to give injections. And so for them, those are challenges that family caregivers need support in order to be able to do the work well and care for their loved ones. And so we've made progress in the US. In 2022, we stood up the national strategy to support family caregivers. So that's amazing progress. There was funding, initial funding, about 20 million assigned to it. But again, that's not sufficient given the large numbers of caregivers. But again, thinking of it as a glass half full, this is the first step. And states have started to come forward. That was at the national federal level. Now states are coming forward with innovations on the policy side and on the private sector side, thinking about how else they can create an environment that can support family caregivers. And again, at AARP, as you know, a nonprofit working in the space and supporting the work of the states and the federal and supporting family caregivers, we offer toolkits, we offer information sharing, and we even provide training to help family caregivers and support policies.
Thank you. Thank you so much, Lena, for that. That's a very, very interesting experience and very interesting points, very important points that you're noting there. And I'm going to move now to Pablo. Maybe Pablo, from the perspective of the IDB, maybe you can speak a little bit to this issue of this massive need for additional resources and capacity, either from the community and/or national level, with your experience at the bank, but also leading into my second question, which is around the barriers. How can some of those then, how can our needs then be addressed and be specifically targeted to advance in the implementation of what Lena was mentioning, which is the 4 objectives of the Decade for Healthy Aging 2030?
Claro que sí, James, muchas gracias por...
Yes, James, thank you very much for your
Obrigada pela
question, and
pergunta
thank
e
you, of
obrigada
course,
ao
to
OPAS
PAHO
pelo
for inviting
convite
me.
do BID. É
For
muito
the IDB,
importante, no
this is
BID é
a very
importante esse
important
assunto
issue,
pelo nosso
given our
compromisso
commitment
de
to
avançar nessa década do
participate in the
envelhecimento
attainment of the
saudável e
objectives of Healthy
aprender e
Aging Decade.
entender
But
das
it's great to be
apresentações dos
here to
colegas.
learn
Os assuntos
from
que estão sendo
colleagues' presentations.
estudados são
What they're doing
importantes, as experiências do
is
Brasil
very
e
enriching. From Brazil
Belize
to
são muito
Belize, we've
enriquecedoras.
learned a lot.
Parte do
I would say
desafio
that
que
part of the challenge
enfrentamos
we
é que a
face is
região
that even though the
envelhece
region is
rapidamente,
aging
sim, mas é um
quickly, the
processo lento.
process is
Nenhum
slow.
governo terá
So
no seu
there is no
período
one
que
government that
pagar
is
as
going to have to
consequências do
pay for the
processo. É
consequences of this
acelerado
process
comparado com a
during
Ásia,
their
por
term of
exemplo, ou com
office.
outros
It may be
países,
happening
mas é um
quickly
processo
compared
que
to
leva
Asia,
tempo.
but it
Isso
still
tem que ser
is something
considerado
that
e
takes
para
time.
isso
So we
precisamos de
do need to
evidências,
have
precisamos de ter informação
evidence-based
a
information.
respeito do que
What
funciona.
works?
A OPAS
PAHO
tem
has been
sido
very
muito
good
boa, junto
together
com a
with
MS,
WHO in
oferecendo,
showing
por
us
exemplo,
what are
o
the
que
best
fazer
things to
para,
do
com as
for chronic
doenças
disease,
crônicas. Sabemos o
how
que
to
fazer,
mobilize
temos que
resources,
mobilizar
and what we're doing
recursos.
here is
Então,
we're crafting
parte das
solutions.
necessidades
So
são
we do need
gerar
to generate
evidências, ver o que
evidence, what
funciona.
works,
E o que
and what Flor
Flor
Murillo
Murillo
said is
disse
also
é muito
important.
importante. Temos que ver
what
isso
is
no
happening in the
terreno.
field.
É
The
o
local
governo local
governments
o
are
que
the ones that
responde.
are
O
leading
desafio
the
é
effort. So we have to
passar dos
see how we
serviços
can move from
locais ao
local
serviço
services to a
nacional com
national
qualidade para
network of
todos.
services that
E em
covers
relação à segunda
everyone.
pergunta,
And then
quais
moving
são
to your
as
second question
barreiras?
about
O
the
que nós temos que
barriers,
entender
I
é que
think that
temos
what we
que
do need to understand
mobilizar
is
os
that we have
recursos
to
com que contamos
mobilize
e
available resources
redirigi-los
and
para responder
rechannel
os
them
desafios.
to address
Uma
these
coisa que
challenges.
trabalhamos muito com a sua
One thing we've done with
equipe
your team
na
already.
saúde,
In
estamos
health,
fazendo
we are
esforço para
making efforts
investimento
to
na atenção
invest in
primária,
primary health care to
preparando
equip
o sistema de
healthcare
saúde para
systems to deal
responder a
with chronic
doenças
disease.
crônicas.
The question
A
is, are
pergunta
we
é
doing enough
suficiente
to
para
also
atender
cover
necessidades de
other needs?
envelhecimento?
For example,
Temos
aging-related needs,
recursos humanos,
human
é um desafio na
resources. That's a
região.
major
Quantos
challenge in the
geriatras,
region. How many
gerontólogos,
geriatric
enfermeiras
and
geriátricas
geroncology
existem na
specialists, how
região
many
para apoiar o
specialized
processo das
nurses do we
famílias
have
que
who
querem
will be
envelhecer
able to
no
support
lar?
families as they want their relatives
Princípios
to
que
age in
temos
place, to
que
age at
apoiar,
home?
mas é um
That's
desafio.
another pending challenge. So it's not
Não
just
só
finding more
conseguir mais
resources. We
recursos,
need to
temos que
have
ter evidência
evidence
de
as to
que
what works because
funciona.
the
O
potential
potencial
is there.
existe.
When we invest
Ao
in these
investir
areas,
nesses
there's a potential
assuntos,
to generate
o
savings
potencial é ter
related to
melhor
healthcare.
saúde,
If people are healthier,
pessoas mais
they
saudáveis,
will
são um
not
custo
need as much
menor,
healthcare.
melhor
They will
qualidade de
also
vida,
enjoy a better
e
quality of
essa
life.
poupança não
It's
é
never
uma
going to be
poupança
absolute
absoluta.
savings
Há
because there's
outras
other
áreas
areas
da
that need more
saúde que temos que
investment. But
fortalecer,
we can
mas
promote
podemos
this and do what
promover,
our colleague from Brazil
como disse a
said.
colega
Among
do
others,
Brasil,
look at
questão de
gender
equidade de
equity.
gênero.
We want
Queremos
good
criar
jobs, and
bons
we also want
empregos e
to
promover a
promote a shared
corresponsabilidade
responsibility
entre homens e
between men
mulheres para
and women when
cuidado
it
de
comes to
todos.
caring
A
for
agenda
older
integral,
persons. So it's
mas se
a big agenda, but if we can
redirecionarmos
rechannel
recursos, e se
resources,
sabemos
redirect
que
them,
na saúde temos que
and
estar
accept
preparados
that
não,
the
para
healthcare
não
sector
só
has to
para
deal not
doenças
just with
crônicas,
chronic
mas doenças
diseases, but with
crônicas com pessoas
others,
mais idosas.
then we need to
Precisamos de
train our
pessoas
staff
preparadas
accordingly so
para
that we can
isso.
be ready.
Obrigado, Pablo. Sobretudo pelos fazer esses vínculos entre o necessário para um envelhecimento saudável e também como expandir o cuidado nas comunidades. Flor, nesse contexto, sua experiência na Costa Rica, esse enfoque localizado, falou do trabalho com comunidades. É esse trabalho localizado que deve ser fortalecido? Quais são as barreiras que vêm a nível local e nacional para poder responder aos desafios?
One of
Uma
the
das
main
principais
barriers
barreiras é
is how do
como
we
chegar a
reach
mais
people?
pessoas.
Let me give you the example of one
Vou dar um
community.
exemplo de uma comunidade
Cartago.
que temos em Cartago.
Cartago has
Ali há uma
a
série de
series of
programas
programs at the local
locais
level.
para
That's their
trabalhar
approach to work
com
with
as
people who
pessoas,
go to the
centros
day
diurnos,
care
17
center. They have
centros
17
diurnos,
such centers.
atenção
They receive
da rede
support
de
from the care
cuidados,
network.
programas
They have community-based
comunitários, de
programs. They have
lazer,
recreational programs,
autocuidado,
self-care, and health
promoção da
promotion.
saúde. Com
With
isso,
this, they
cobrem
cover
quase
almost
2.000
2,000
pessoas, mas na
individuals, but
comunidade
there's
tem
about 17,000
17.000.
in their community.
Como chegar com
How do they
recursos
find the
humanos?
human
Como
resources to
chegar
reach
com
these individuals? How do they
outros
get material
recursos para que
resources?
as pessoas
And how could they bring
participem do
people
processo
on board,
e ter,
engage them
então,
in the process so
melhor
that they can
qualidade de
have better
vida
quality of
em
life,
termos de
better
autocuidado,
self-care, and
promoção da
better health,
saúde e promoção
and
do
a better
envelhecimento
aging
saudável.
process? So this,
Esse
I would
é um dos
say,
maiores
is one of the top
desafios,
challenges we face.
como
How do
cobrir
we
o maior
expand our
número de pessoas
coverage?
com
How do we find the
recursos
resources at
locais
the
e
local and
nacionais.
national levels to cover all
Sabemos
these
que a nível
individuals?
nacional,
At the
a
national
Costa
level,
Rica tem
Costa
uma
Rica has an
vantagem em
advantage as
relação
compared to
a
other
outros países.
countries.
Somos só
We have a
5
population
milhões
of
de
only 5
habitantes
million,
e
and
10%
10% of
da
that
nossa
population is
população
older persons.
está nesse
So this
setor. Então,
means
temos
that
mais
we may
possibilidades de
have
ter
more
programas
possibilities to
para
set up
trabalhar
programs
na
and to work jointly
institucionalidade
with
do
other
Estado, do
institutions, the
setor
state,
acadêmico, das
academia,
ONGs, com
NGOs,
organismos internacionais,
international organizations. We
para
are
trabalhar
able
a
to work
nível
at the
nacional, ao
national
mesmo tempo que é
and
o
local
nível
levels
local,
because our population
porque
is
a
relatively
população é
small compared
relativamente
to that of other
pequena
countries.
comparado com o resto da América
And yet,
Latina, mas é
it is
importante
important for us
trabalhar
to focus
na
on how
abordagem
to
do
expand
máximo número de
coverage,
pessoas, como
as we
também
did
na
with
atenção
primary health
primária,
care.
como essa a atenção
Primary health
primária da
care has expanded its
resposta ao maior
coverage to
número
reach
de
more older
pessoas idosas.
persons.
Nossa saúde é
Healthcare in Costa
universal,
Rica is universal.
acesso à
There is
saúde
access,
existe,
fortunately,
mas
and even
mesmo
so,
assim,
there are many people
muitas
who are
pessoas
left out.
ficam de
So
fora.
that, I
Esse é um
would
dos
say, is one of
principais
the main
desafios
challenges we
em
face
termos
when it comes
econômicos,
to
sociais e,
economic issues,
sobretudo, em
social
termos de
issues, and
saúde.
especially
Obrigada.
health-related issues.
Obrigada, Flora, por fazer esse vínculo. E eu acho que isso está muito ligado com essa última pergunta que eu tenho para a Lina e para os outros panelistas, nos 4, 5 minutos que temos nessa sessão agora. E eu acho que isto, nessa década de envelhecimento saudável, o que nós ouvimos dos panelistas essa tarde, há alguma área de foco principal na qual sua instituição, o seu país deveriam estar trabalhando, ou precisamos de um enfoque integrado que vai além do setor social, da saúde, tendo um enfoque mais integral dentro da estrutura da década de envelhecimento saudável. Quais são uma ou duas áreas principais nas quais temos que trabalhar? Nina. Eu acho que seu microfone está apagado, Lina.
Thank you for that question, and sorry that I was on mute. That's actually a really difficult question, just to narrow it down to one or two. Requiring me to do that, I would say it's really important to start by thinking about how we change our perceptions of age and aging, because that in itself then would affect the work that we do around ageism. That affects the way we think about healthcare and long-term care, and also enables us to think more sort of about how we build communities that are ageless, that are for multi-generations, that includes older people so that they can thrive, and then younger ages as well. So I think particularly in terms of the work that we've been doing around ageism and in the workplace, for instance, it is so pervasive in the United States and in some of the research we've done elsewhere, from far more so for women in some cases than it is for men. And so thinking about how we tackle these negative perceptions of aging, and then thinking about how it affects all the different communities differently, because the issue of disparities in access to work, to care, to health, to community support is very real. The research shows that the solutions cannot be one size fits all. We have to think about solutions that are targeted to the population, respecting their culture and their community. So I think the two things then would be changing the narrative around aging and thinking about how we support all the different cultures and communities and the diversity that comes with our aging population.
Excellent point. Yeah, I think that's one of the key areas we need to start, certainly, and really move forward on that, I think, region-wise. Pablo, over to you for your thoughts on this and some final considerations.
Sí, no, muchas gracias. Creo que
Thank you very much. What I think is, and this is common both to health as well as to care services, is that we must have two basic principles. One is people-centered care that goes along the lines of what Lina was saying. We want to have appropriate services for different communities. We have to reach other people and find the person wherever they might be and provide care, be it on health or other type of care with that approach. And secondly, to invest, to acknowledge and value the work, the necessary human resources in order to provide these services, both on health and on care. We know that a lot of the care, as was mentioned, are done or offered by relatives. So I believe that the care agenda is the agenda of human resources. And we're very clear about the importance of the well-being of the people that need care to achieve their autonomy, to contribute so that they will be able to continue with their life plans. But we must also place at an important level the services, and that has been done in Latin America, to acknowledge that these persons are very important segment of the population, and we have to insist on that, be it on services as well as on care. Thank you, Pablo. Y Flor? For my closing comments, I'd like to send out a message about the importance of working from within the communities, the importance that this has in order to reach these persons, and the effort that has to be made in not remaining at a national level, but to reach all the different spheres that have to do with management levels, and in order to develop projects and successful programs such as cities, such as age-friendly cities and communities, and such as ICO, and all the programs that are carried at a local level in health and promotion and self-care. Thank you.
In this panel, I think some of the takeaways from this, in summary, really the need for national strategic political engagement and action that comes from the bottom up and from the top down, really addressing the needs of people where they live in their communities, bringing to bear advocacy to address issues of ageism, and then the resources and the structures and the mechanisms that are really required to provide integrated care, but on a very strong foundation of primary health care and social care. So I think these are some of the key messages that I've taken from this panel. So thank you to each of you. And with that, Patricia, I'll hand back to you. Thank you very much.
Muchísimas gracias a todos y a todas, y Dr. Fitzgerald por liderar esta conversación.
Thank you. Thank you to everyone and to Dr. Fitzgerald for moderating this session. It's clear that the steps forward require that we all reflect on strategies that have been successful and what needs to be bolstered at the national, regional, and local levels so that we can provide for healthy aging for all the population of the region and better well-being and equity during their older years. I'd like to invite Marta Pelaez to close. She represents the Association of Former Staff of PAHO and WHO, and she will make some final comments. Marta? Thank you very much, Patricia.
I want to just simply congratulate everyone who has presented. Obviously, we have the stories I have heard show that we are making progress, but we also need to continue planning and to do that even more strategically, because 2030 is around the corner. We do not have a lot of time left. I'm here today, as Patricia mentioned, as a member of the Association of Former Staff at PAHO, WHO, but I'm also here as an 81-year-old who has actually dedicated much of my life to promoting healthy aging. My closing remarks are going to be very simple, but are going to come from those lenses. I would like to ask you to pay attention to one important driver of success in your strategic planning. Without this driver, which I'm going to mention in a moment, it will be impossible to achieve the goals of the decade. The decade calls for change in the way we think, we act, and we value old age. And we know that change can be driven by institutional leaders such as yourselves, but also by grassroots movements. And the best practices that we know in the public health history is change occurring when there is a coalition of both. Nothing about us without us. I'm sure you have heard that statement. No meaningful change will ever occur by the work only of institutional leaders without the full and direct participation of groups affected by that change. So I'm going to give you just a simple example. The Convention on the Rights of Older Adults is a powerful political and legal tool. However, without massive education programs to empower with knowledge of the rights individuals and their families, as well as groups of older adults, the convention may remain just that, a real good tool that will be rarely used. But that is really not what the convention is all about. We really need the grassroots movement that demands that the convention be implemented, not only exist, but be implemented, be activated, and not only by some, but by all, inclusively by the UN and its agencies. We all have to take it seriously. Another example, and that only is going to happen when people who are affected by it demand it. So another example, age-friendly communities. I know you're doing a lot of things that are important for older people. However, I wonder how many have established false prevention coalitions within your age-friendly communities to monitor not only when people get to the hospital, but when people are really falling or when they're not really active because of fear of falling. False surveillance in the community could be a powerful tracer of healthy longevity. And what I mean by that is that preventable falls occurs because of preventable frailty, many times, not always, but frailty may lead and often does to falls. So we talk about preventable death, but do we monitor the degree of preventable frailty in the community? Is ageism the internalized version of ageism, the ageism that makes older people say, I'm too old to exercise, I'm too old to do this, I'm too old to do that? Is ageism giving older persons an excuse to accept frailty? Do age-friendly communities include fall preventions as a measure of their success? If you ask me, that may be something that in each of the work areas could become a tracer of how much we are really paying attention to what really matters to older people. Like in the experience of Chile and Costa Rica that we have heard, when you implement ICOP, you assess the capacity of older persons. But how many times do we really pay as much attention to the self-care, the self-management support that person may need in order to work at falls preventions? Are there physical therapists, occupational therapists, trained in supporting older people to minimize fall risks? Because we cannot just say to an older person, please do not fall. We really need to be able to identify how can that person strengthen his or her intrinsic capacity, but we also have to look at environment. We have to look at many functions of balance and flexibility, as well as strength, that are important, are essential for even a 100-year-old person to actually avoid falls. So if we're fortunate enough to live a long life, and I hope I do, I will need some care at the end of my life. And a fall may precipitate that moment when I need care. So having caregivers that know what they're doing is crucial. It's not only the fact that I have someone, but someone that knows what they're doing. Having options so that we are able to choose the least restricted environment for care when I need it would be an age-friendly goal. So many of you may want to ask older persons in your community what they think about long-term care. Because if you know what they think about long-term care, you may definitely get a great agenda for the future of your community. And I'm talking about the local level. I agree 100% with Flor. The local level is where things happen. And age-friendly communities at the local level have a great, powerful moment as long as you really get older persons involved. It's nothing about us without us, remember. So I want to take a minute to, as just a couple of minutes of what's left, to tell you what I think is great. It is hard to reach older adults. I get it. We're not homogeneous. We are not all retired. We are not all accessible. Many of us are remaining totally isolated. You reach children at schools and you have school programs, et cetera, et cetera. How do you reach older adults? Not all of them are retired, but let's start with the low-hanging fruits. Let's do something. So there are many retirees associations, such as public employees, farmer collectives, doctors and lawyers retired, civil servants, such as PAHO retirees or former PAHO staff, former IDB staff, former World Bank staffs in your country. Many of us are active. We're not really retired from life. We're simply not working institutionally, but we're very active. And we would respond to a call for engagement as long as that call for engagement is meaningful. So a movement of older adults promoting healthy aging in a community would be an essential driver of success for the decade. And you really need to figure out how to do that. It's not easy, but you got to figure it out. A grassroots movement with a recognized local leader, a clear agenda to ensure that the areas of the decade are not just work in progress, but are really implemented with a grassroots movement supporting your institutional leaders, as well as your institutional leaders understanding what really drives this grassroots movement. A grassroots movement that brings intergenerational dialogue to find solution for inequities in healthy aging at the local level and work together to ensure that the gift of longevity is passed on to future generations. In other words, the octogenarians in your community have a responsibility to pass the gift of longevity downwards. And how do we do that? By showing that healthy aging is possible. So what we have learned, we have to share. We need to really take very seriously the threat of ageism, but the threat of ageism is not just something that affects institutions, it's not just something that affects population at large. The threat of ageism is even worse when it's internalized. And older people are ageist. Why? Because they have internalized a whole history of ageism. You know, why should I actually behave in any other way than society wants me to behave? And that really becomes a real threat to healthy aging. So I think we really have a lot of work to do. And that work is going to have to be with older people, and it will have to be to fight ageism at all levels. But begin with your older generations, because if they understand that yes, they can, and they can be healthy, they can be functional, and they can actually, they have a responsibility to pass on the gift of longevity to future generations with lessons of how to actually be active and contributors in your community. That actually will be a very important goal of the decade. And with that, I finish my remarks.
Thank you so much, Marta. It was amazing to count with you to close the event and bring this ideas, and especially the importance of participation and meaningful engagement of other people in all the process that we've been talking about on the decade. So with that, solamente quiero agradecer a todos por la participación.
I would like to thank everyone for participating. This concludes this webinar. We invite you to continue to participate as we continue to work to improve the quality of life and aging of people, their families, and communities for the decade. Thank you very much to everyone.
Gracias.
Hasta luego.